Come in.
Oh, hey, how are you doing?
Hi, Dr. Mitch. Nice to meet you.
Nice to meet you.
What's your name?
Ethan Ridlen.
Hi, Ethan.
May I
Nice to
see-
meet you. Yeah, go right
Oh,
ahead.
okay. I know you rushed on time, you got a lot of patients to get to, and
Yeah, I've got about 15 minutes or so.
15, okay, I think we can get a lot of things figured out in that time. Well, again, my name is Ethan Ridlen. I'm new to this area of the town. I just moved here, got a job with GSK, which is GlaxoSmithKline. I'm sure you're familiar with that.
Yes.
Uh,
We actually currently feature Imitrex.
Oh, yeah,
in our
yes,
office,
yes,
of
I'm
course.
very
Well,
familiar
you
with that.
probably knew that already.
Yes, I did a little background information, and I visited with a couple of your colleagues around the area, and they spoke very highly of your practice, and they also gave you a very high rating and looked at you as a big center of influence in the things that they do. So.
Oh, well, that's a big compliment. I didn't think they liked me that much, but
Oh.
no, I'm just kidding. But no, yeah, I have a very tight-knit little group of physicians. There's about 5 of us that always, recommend customers to each other, exchange information about pharmaceuticals.
Yes.
So as you probably already found out, and yeah, we just really make sure we all like to emphasize, being empathetic in nature to our customers. So.
Well, I did a little bit of background information on you. I know you've been in practice for quite a long time, 20 years, and,
Yes.
the people I've talked to about you, they speak very highly of you. So, and they said that you know a lot about your product. And the reason I'm here today is to introduce myself, build a relationship with you, because I plan on being in this business for quite a while, and I want to introduce you to a new medication called Treximet.
Okay.
I read up some statistics about your practice that I called your secretary about, and she said that about 25–30% of your clients suffer from migraines.
Yes, it's
Okay.
quite a bit, and right now like I said before, I do prescribe mostly Imitrex, and then if Imitrex doesn't work, I prescribe Maxalt by Merck. But I've noticed that the Maxalt doesn't work as well
Yes.
as Imitrex, but the problem with the Imitrex is sometimes there's a lot of side effects,
Yes,
obviously, and if one of my patients doesn't respond well, I have to switch them to the less useful medication, so it's a little frustrating.
Yeah, it sounds like you might need another alternative to that. So I would assume. Tell me if I'm wrong. Like, are you looking for another alternative?
No, I'm actually very interested, and I figured I had heard that GlaxoSmithKline were coming out with a new medication, so I figured that would actually be what you were in about today. So I did a little bit of research.
Okay.
Preliminary. Now there's some things that I wasn't really able to find out in my research.
What were the things? Well, I'll answer the best I can.
Okay, well, first of all, one thing I did notice that there seems to be a lot less side effects
Yes.
with the newer medication versus Imitrex.
Yes, great.
But what I was concerned about is are these benefits that the patient will receive from this newer medication scientifically greater than the side effects?
Yes, they are. That's one thing we're taking pride at GSK is that our new medication is much better. Treximet is just a newer, better version of Imitrex. It has a dual combination ingredients, which makes it act faster, and you'll need less of it. And I think that's a great thing. Your clients, your patients won't need as much medication. They'll just have to rely on maybe one a day if they have an episode.
Oh, okay. So instead of, I didn't even look at the dosing actually. So instead of taking it multiple times a day, they could just take it once for the day.
Yes.
Okay.
One should do the trick. There might be those cases to where you run into some trouble where clients might need to take another one, but it's designed to just be taken one and done.
Okay, so that must be the reason it has less side effects then, right?
Yes.
So as you're taking the medication once instead of multiple times, you're getting less extra medication in your body, right?
Yes.
Okay, interesting. No, that definitely makes sense. I didn't even think about that. I was also, so basically then I don't have to with this newer medication, the benefits are definitely going to exceed the side effects then?
Yes,
correct?
I mean,
Okay.
with every medication that a person takes, there's always going to be a chance of side effects. And side effects are just chances that experimenting scientists that develop medication have witnessed. It doesn't mean you're going to get them, but like with any medication, you're going to get side effects. But these are extremely low. They're very low, and they're
Less impact?
yeah, low intensity is the word I'm looking for. And
Okay.
yes, whereas Maxol and Imitrex, they have some pretty high intensity side effects that you know you may not get them, but still there's a chance there, and Treximet eliminates most of those.
Okay, so what are some of the worst or like more severe side effects that have been eliminated?
Depression, heart disease. Maxol has been.
Those are pretty big.
Yes, the Treximet isn't linked to either of those. Maxol has been linked to maternal problems, so women that are pregnant have had problems while taking.
Yeah,
so,
that's...
And Treximet does not have that.
Oh, great, because
Yes.
actually, I usually have to order someone and automatically order a blood test to run a pregnancy test whenever I prescribe anybody with Imitrex.
Yeah.
Just because I need to make absolutely sure that they're not pregnant
Yeah.
because of that. So that would really actually save my patients some money if they were able to not have to worry about having a bun in the oven.
Yeah.
So.
Yes, definitely.
But you know, I am curious though, what are some of the long-term impacts as far as side effects go?
Well, I have listed right here. Some of the longer-term side effects are again, they are side effects. It just means there's a chance, but it says here there's muscle pain, anxiety, numbness, tingling, increasing your appetite, which will lead to weight gain, and diarrhea, which aren't too severe. None of those are anything that you can't fix, and again, they're just like with side effects, it's chances.
Yeah, no, that does seem significantly less severe. So if I noticed, so I guess what I'm trying to say is, if now these are things that are going to be, if they do happen, they're going to be happening after taking the medication for a while then?
Yes.
Right,
yes.
okay. So this is something for me to kind of just look out for just in case, as opposed to worrying about it right away?
Yes.
Okay, all right.
Is there any other concerns that you might have concerning this medication, or what are things that you're looking for in a new medication? Because I know doctors, I know especially you want to look out for your patients, number one. You're not in it for the money or whatsoever. Like that's the vibe that I get from your colleagues, that you just really have the heart and the passion to just help others.
Yes, I actually only have a 5% turnover rate, which excludes our death rate.
Yes.
But I shouldn't be laughing about that.
Yeah,
But and 20 years of practice. So I do, I really care a lot about my patients, like you said, and myself and my colleagues. One of the most important things to us is the happiness
yes.
and well-being of our patients.
Make sure they're satisfied.
Exactly.
Yes,
So I guess one other thing I would be concerned about as far as my practice goes is, are there going to be any benefits or disadvantages for me prescribing this medication?
I don't think there'll be really any true disadvantages, as far as there might be. The one disadvantage that I could say is it might be just a little more expensive for your patients. But I think it's well worth it, because yes, it may be a little more expensive, but it works better. It will cost them less money in the long run, because they won't have to buy as much medication, because it is just one pill. That's what it's designed to do, and it's a great pill. It's worked. There's results I have in this pamphlet right here. It tells exactly.
Oh, and I would love to see some of the statistical data.
Yes, right here. Oh, I got a lot of it. Oh. It's all right here. Just hand this to you. That's all about Treximet, everything that goes into it.
Fantastic. We've got the.
And then here's again is all the possible side effects and ratings and whatnot. It goes on for a couple of pages.
Okay.
But as far as it is a proven medication, it is new to the market, so it is a little more high priced. There isn't a generic for it yet, but its benefits far outweigh.
Wow, this says that 25% of the people who took this, 25% out of 364 people had no pain at all for 2 to 24 hours. Sustained pain, that is some really impressive results, actually.
Yeah, I mean, we're trying to do big things at GSK, you know.
Okay. That's fantastic. Well, would you mind if I held on to these just
Yes,
a
you
little
can
bit?
have them. Yep.
Oh, thank you very much.
You're welcome.
Okay, so now, would you have samples available for me to pass out to my patients?
Yes, I do have samples with me.
Okay.
I can give you those samples, or would you be interested in, I'd like to establish a relationship with you and your practice to where we can come back and maybe discuss other hospital medications that you would like to sample or give out. So, but I can give you those samples, or we can talk about just ordering that product. And
I have a few more questions
Oh, you do? Okay.
before we talk about any ordering, if you don't mind.
All right, go ahead, right ahead.
I was a little concerned about, now, do you feel that, like, can you tell me how the ease or safety of switching my patients onto this medication, like, are they gonna have any health issues from the switch?
That's a good question. I'm glad you brought that up. That has been a lot of questions that has been asked to me. That question has. And so far, there's been no data or any type of experiment finding out that it is bad to switch.
Okay.
So basically, I'm saying that it is okay to switch medications. We do suggest that you wait about 3 to 5 days before you switch medication, just so the old medication has a chance to
get out of the system.
filter out of your system. Yes.
Okay.
Yes, that is a great question.
No, that's actually a really great benefit, because that's one thing I really have to watch out for, especially with side effects including things like anxiety or depression. When people go off a medication too quickly and switch into something else, sometimes their body doesn't have enough time to react, so it can be very uncomfortable for the patient, and obviously I'm constantly looking out for not only their physical well-being, but their emotional well-being as well.
Yes, yes.
I think